Let's begin our session with Umar Kitab al-Fatih. Can I, before we begin, can I remind the group leader? I don't know who the group leader who texted me before and reconfirmed the time. Who was it? Shafiq here. Shafiq. Shafiq is your group leader kan? So kan? Okay, so what I want to remind you is, you need to reconfirm with Farah, Mr. Farah from our department, and remind us about the link, because we have 4 links for teaching, and because the same link may be used with for other departmental activity and also for other for year 3 as well. So you need to reconfirm which link that you can use. You cannot just assume that you're going to use the same link for every teaching, because sometimes you may use other links and sometimes you may even need to use Google Meet or Microsoft Teams or whatever other app available. Okay, so your group leader or whoever is arranging the session need to communicate with the department, Mr. Farah, and make sure which link that is going to be used. Okay, all right. Okay, so this morning the topic that I'm going to give to you is about communication in pediatrics. I've told some of you guys before, the problem with us in Malaysia, among Muslim Malay in Malaysia, among our problem is that we do not communicate well. We have a bit poor communication skills, because many times communication are not actually taught in school. Communication skills are not taught in universities and things. I've handled students exams in UK, US, and I've handled non-Malay students. The thing is, what I can tell you is that in terms of knowledge, for example, in terms of knowledge, IIM students are at par. We are similar. You all have adequate level of knowledge and information in you. The only problem is that communication skill is a bit lacking. Many of you don't communicate well, don't relay your knowledge well. Sometimes even in case presentation. This is the same example that I've been telling to so many groups before. It's like nasi lemak. Every one of us likes nasi lemak kan? Semua orang suka nasi lemak. Ada tak siapa tak suka nasi lemak? Malaysian, we like nasi lemak, kan? But can you imagine, you have someone, you nak beli nasi lemak daripada dia. You know nasi lemak dari yang makcik ni jual memang best, memang sedap. It's the best nasi lemak in the whole world. By a randomized control trial, many people have with good sample size is evidence based, saying that this makcik ni nasi lemak is the best nasi lemak in the whole wide world. Tapi makcik ni dia bungkus nasi lemak dia ambil, dia campak kabar tu, letak plastik, campak semua gaul dia tu, ikat dengan tali rapia kan. You rasa interested nak try kan nasi lemak dia? Do you feel enticed to actually makan nasi lemak dia? Walaupun dia tahu evidence based, memang sedap. Bau tu kita tahu sedap kan. Tapi cara dia package dia punya nasi lemak tu, cara dia present dia nasi lemak tu, doesn't make people interested. Kan? You pernah makan nasi lemak dekat hotel? Nasi lemak dekat hotel kita pernah makan kan? Do you think it's tasty? No one in the world will say nasi lemak dekat hotel tu is tasty. Semua orang tahu it's evidence based, it's by experience, expert opinion. Semua orang tahu nasi lemak dekat hotel tak sedap kan? Tapi dia package macam mana? Dia letak tu nasi pun nampak berasap-asap kan? Kuah dia pun, sambal dia pun nampak macam best kan? Kan? Semua orang rasa interested nak makan. Tapi semua orang tahu memang tak sedap. Tapi kita rasa kita nak makan. Sebab apa? Sebab presentation dia tu menarik. Ini sama juga dengan kita. As doctors, as medical students, if you are able to communicate well our opinion, if you are able to communicate well our ideas, if you are able to present well, if the presentation is good, sometimes even small errors, small mistakes, people may forgive you. Tapi kalau you present badly, even though your presentation is complete, semua benda ada. Tapi if the way you present is bad, kan, people may notice even the small mistake. So ni benda yang this is the thing why we need to inform, or why we need to teach you about this. And then you all semua nak jadi will become doctors. And what I can tell you is that more than 90% of medical legal issues, is actually stems from poor communication. And when we don't communicate well, the issues with our patients, with the family, so what happens is that will be communication breakdown. Communication breakdown results in medical legal issues, unhappiness in workplace, also because of communication breakdown. So communication is actually very, 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 very important. Okay, all right. And then we notice as well in exams, especially your group dah terlepas lah. Yang year 3 ni dia ada dia punya part of dia punya exam is communication skill. We test their communication skill, and what we notice is that many of them have very poor communication skills. Kan, tak tahu nak counsel patient, tak tahu nak cakap apa dan sebagainya. So this is the reason why. And I think only 3 groups from year 5, only 3 groups yang ada this topic, communication in pediatrics. Yang the first 2 groups tak dapat pun this topic. Okay, alright. The first thing I want to tell you is that children are not small humans. They are not miniature humans. They are not miniature adults. They are by themselves. Why they are not small humans? Actually, because they have different cognitive development. Children before 1 year old, children before few months age, they understand. They have different cognitive development. They can understand different things. Children more than 1 year old, they may understand different things. Children more than 2 years old, they understand different things. Children more than 3 years old, they have different understanding, different cognitive functions. Children more than 4 years old have different cognitive functions, and so on and so forth. So children at different stages of development, they have different cognitive capability. So when they have different cognitive capability, they may understand things differently, they may communicate with you differently, and the way you communicate with them also should be different. I'm not saying kalau you are talking to children, if you're talking to babies, then you need to do baby talk. No. If you have babies, I'm a neonatologist. If I speak to my baby, do I speak to our newborn baby? Yes, we do. We need to acknowledge them, despite they don't understand what we're talking about. But we do need to communicate with them, even though they're small babies who can't speak. It doesn't mean that we need to do baby talk with them. Kalau baby tu boleh cooing saja, it doesn't mean that we need to coo with the baby. If the baby can only babble, doesn't mean that we need to babble with the baby. If the child can only speak in a single word sentence, monosyllable, it doesn't mean that we need to speak with them in a single word sentence and monosyllable word. It doesn't mean that. We still need to communicate fully in the proper sentence, but sometimes the level of jargon that we use, the level of wording that we use, simplicity of the sentence, and the level of the depth of the information that we want to tell them, all need to differ according to the different cognitive capability of the child. So they have different cognitive capability at different stages of life. This is one thing that we need to acknowledge. And you all are going to become parents. Don't do baby talk with your babies. Speak properly. Eh? The more you speak properly with them, the better they can understand. And then they have different motor and speech development, as I said before. Sometimes in terms of speech, children, they start with cooing, and then they may babble. At a few months old, they can babble. Around 6-8 months, they can start to babble. And then by 1 year old, they can speak in a one-word sentence, single word sentence, monosyllable words. By 2 years old, they can speak in a two-word sentence, can be monosyllable. By 3 years old, they can speak a proper sentence of at least 3-word sentence. They may memorize nursery rhymes. So how they communicate with you also depends on their own speech development, speech and language development. And remember as well, sometimes children who are bilingual, children who are multilingual, sometimes they may be a bit delayed in terms of their own speech, tapi in terms of intellectual function, sometimes they may be better. So understand their assessment. And also things like if you assess certain things, if you assess color, for example, you need to remember that some children, they are taught in a bilingual, multilingual issue. So sometimes kalau you tanya satu color biru kan, sometimes they don't understand what they're saying because parents dia ajar in English or in other language. So acknowledge the different language and then different motor capabilities. They have different motor capabilities. So that is why sometimes you may assess, you may communicate with them but you need to acknowledge the different motor we have. And also remember as well, their communication skills will depend on their upbringing as well. Kalau upbringing dia very suppressive, children are not allowed to speak. So it's going to be very difficult for them to relay their opinion. It may be difficult for them to say. If their upbringing is very vibrant, children are encouraged to speak. Children are encouraged to say what they want. So sometimes children like this, it's more easier for you to get more information, more history, and so on and so forth. And as well, parental expectation. If the parents expect them, sorry, ada patient lah. Okay. I have patients. Okay, fine. So parental expectation also affects how you may communicate with them. Okay, next, newborn are still to be communicated with. If you have a baby, if you have a newborn child, it doesn't mean that you don't speak to the newborn. You need to still communicate with the child. If you want to do procedures to them, you still need to communicate with the child. And you remember, newborns, they respond to social cues. You smile to them. Obviously, social smile is only around 6 to 8 weeks. They don't socially respond to you yet, but they may understand social cues. So communicate with them, and then they may, voice, hearing. Hearing is among the first sensory that is developed. And the Quran, Allah mentioned in the Quran, in the Sam'a wal Basar wal Quran, in the Sam'a. Basically the same thing. In a human being, in the fetal period, the first sensation that you develop is actually the hearing. So hearing is the first sensory that develops in a human being. So that is why even in utero, they can actually get sound and things. So when parents speak to them, even though in utero, they may develop better, they may understand, they may read earlier, and so on and so forth. So that is why sometimes in newborn babies, if they hear their parents' voice, many of them they improve much faster. So and then you read to them. Studies have shown newborn babies who are read to, ada orang baca buku pada baby ni, many of them they have faster, they are more literate. They can read books later on much earlier than their peers. So early literacy is associated with reading books in a newborn period as well. So that is why read books to children. So if we have long-term babies who stay long-term in our unit, it's very good if we encourage parents to come and read books to them. So sama juga, you all nanti ada baby, baca buku to your baby, and they understand rhythmic sound. Mengaji Quran, other whatever sort of classical music, so they understand, they get it, and they may respond to it actually. Okay, orang mana bang? So when we communicate with patient, one thing we need to do is we need to plan the session. It cannot be an ad hoc session. When you plan what you need to do, you need to have a clear objective. So bila kita nak Dia kita nak communicate with our patient. The first thing is we plan the session. You need to have a clear objective. There must be a clear reason. There must be a clear objective that we want to reach and achieve. And you need to have appropriate personnel. Who are the people who will join you in the session, in the communication session? There must be appropriate personnel. There shouldn't be anyone that is not supposed to be there. If you need a nurse to be there to relay information in a more layman term, you need that. If you need a language translator, you need to make sure that they are there. If you need physiotherapy, if you need who else that you need to be with you with the session, you need to call them. So you need to have the appropriate personnel. Who are the appropriate personnel that should be with you? And it needs to be scheduled. You need to plan it properly. You cannot do like you have clinic, you have this, you have that, and then suddenly you have that session for you to communicate with your patient. So you don't want it to be a rush session. It needs to be a scheduled time. And you need to have adequate preparation. For example, if you wanted to counsel about G6PD deficiency in the baby, so you need to have the pamphlet, you need to have the documentation, you need to have the adequate information, adequate personnel, and then you may ask the parents if they have, because many times when you plan for the communication, you plan for the discussion, they actually already have some idea about the problem. So you may ask them early on. So prepare whatever questions, whatever concerns that you have. And sometimes if you get them earlier, then you may sort out all the questions, all the issues. To settle all the concerns as well. Setting. So you need to have a good setting. So you need to plan the setting of the session. You need to have a proper privacy. You cannot just communicate. You cannot have a session where you speak about sensitive issues in public. You need to have a proper privacy session, especially in certain cases. If you expect the parents may cry, for example, the patient may cry, you expect a setting where they can cry in privacy. So make sure there are privacy. And if you're talking about palliative care, for example, you need to create a privacy enough environment that the parents, the patient can actually cry and be comfortable. It needs to be comfortable. The chair, the setup needs to be comfortable. You cannot just do counseling about sensitive issues, about palliative, for example, but standing. It's going to be very difficult because some people, they need to sit. They may fall. I've had a patient who fell down when they heard about this palliative care issues, end of life care, for example. Yes. You need to have appropriate personnel. Who do you need to be with you? Many times in communication setting, you cannot be alone. You need to have someone else with you, not just for to translate things, not just to relate it, but also for medical legal purposes. You need someone else to be with you to confirm what actually you have said. In case there's a medical legal issue later on, at least you have someone as witness together with you. So you need to have appropriate personnel, and the setting must suit the purpose. For example, if you're talking about palliative, you're talking about end of life care, you need the ambience to be appropriate lah. Tak boleh lah ada background lagu radio Zayan apa kat belakang kan. You kena ada ambience dia kena, yang suit the mood and suit the purpose of the setting. The room must be an appropriate room. You need to have appropriate equipment. If you're talking about, for example, palliative care, and then what else do you need to do? You need to teach about. If you need to talk about resuscitation, if you need to talk about assessment of right hip position, for example. So you probably need the equipment there for you to teach the parents. If you're talking about long-term oxygen, home oxygen therapy, for example. So you need to have the appropriate equipment for you to teach the parents. So this is the SpO2 machine. This is the suction, so on and so forth. So you need to teach them. So you need to have the appropriate equipment available, and you need to make sure that there are no disturbance. Like this morning from when we begin aja ada berapa kali people interrupt me kan. So ideally when you communicate with patient, you need to have an environment where there are no disturbance from your phone and so on and so forth. Okay, and then when you begin the session, you need to have a good introduction. So introduce properly. Begin lah dengan Al-Fatihah ke apa, tak kisah, it doesn't really matter. Because Sunnah, the Prophet never taught us to start anything with Al-Fatihah. It's not part of Islam, it's part of Melayu. But what the Prophet taught us is we start everything with Bismillah, with Basmalah. So we start with Basmalah and so on and so forth. But we need to introduce properly. So the same goes when you do long cases and short case. This communication is the same as to what you do in long case and short case. Appropriate setting, appropriate personnel, and everything is the same thing. So sama juga bila you start, you need to introduce properly. You need to I am Dr Syed. So and then you need to introduce as well who are there with you. If you have your lecturer with you, if you have your colleague with you, introduce them. Every one of them you introduce to the you introduce. And then you explain as well the role. So kenapa orang-orang ni ada? Why this person are with you in the session? You need to inform them. So my lecturer is here to be my examiner. My lecturer is here to teach us how to do things. So now the physiotherapy is here in the session to then talk to you about physiotherapy at home. The medical social worker is to talk to you about issues relating to financial issues, for example. Psychiatrist is here to help you to discuss regarding the options for psychiatric help that we may offer to you. So you explain the role of everyone that is present in the room, and then get consent. So tell them, okay, this is the objective of the session, and can we proceed? Can we discuss about this? You get consent about the things that you're going to do in that session. Get consent from them. Even if you are trying to, even if the session is for you to discuss about results. For example, baby datang ward, ambil ward, you buat chromosome study. Lepas tu you bagi appointment untuk discuss about the chromosome study result. So bila dalam appointment tu you discuss, okay, today we're going to discuss about the chromosome study punya result. Jadi okay, so kita kena dapat consent from them. Sebab you cannot discuss something when they don't give you consent. Okay. Next, ascertain the objective. So I mentioned before, all attendees should know the purpose of the session. It cannot you plan something else, parents to expect something else. Kan? Lepas tu physiotherapist expect something else, surgeon expect something else. All attendees have different objectives. All attendees have different purpose. Cannot. You need to have a targeted, you need to have a unified purpose of the session. Everyone should share the same goal. Okay. And then know the background. What do I mean by know the background? So you need to know the background of the attendees, the parents, the patient. You need to know their background. Dia apa? Dia study macam mana? Apa level dia? If they are doctors, sometimes you need to speak in a different way. The depth of the knowledge may be different. If they don't go to school, they only go to primary school, for example. So the depth of the information may be different. If they are lawyers, for example, and you nak communicate about end of life care, tapi parents dia adalah both lawyers, both medical legal lawyers, for example. So the level of information you give may probably be different. The tone of the language may be different. And remember as well, another issue is language. Can they speak Malay? Can they speak English? Which language do they prefer? Do they only speak in Cantonese? Do they only speak in Mandarin? What language do you need? So if they don't understand, if you and them don't have same language, so who do we need to call? Do we need to call a nurse? Do we need to call someone from the language line? There is satu language line yang kita boleh call, they will translate for you. Do you need their help? Do we need the hospital to get someone to translate for you, a translator? Do you have, sometimes you may have Arab patients from Arab countries. So sometimes you may call a doctor that understands Arabic, for example. So understand their language, get their language that they prefer. Level of education I mentioned before, what do they work as? Level of prior understanding, always assess. Mak, ayah, kita hari nak discuss pasal rawatan untuk anak. Sebelum kita mula, saya nak tanya, apa yang sebelum ni mak ayah, ada orang dah pernah cerita apa-apa pasal kes anak ke? Apa yang mak ayah faham? Apa yang mak ayah tahu? Boleh cerita saya apa yang boleh cerita apa yang doktor sebelum ni dah bagi tahu. So, kita nak kena assess dia punya level of prior understanding of the ni. And then understand their expectation, apa yang mak ayah harapkan, apa yang mak ayah harap daripada session ini, dan apa yang mak ayah harap daripada rawatan untuk anak ni. So we need to understand their expectation. Assess understanding, as mentioned before, ask level of comprehension of what they have been told before, and the level of comprehension of what you have told them at different stages. So kalau session tu half an hour, probably every 15 minutes you need to assess. Okay, mak faham ke setakat ni, jelas ke tak? So ask the level of comprehension. Use language accordingly. Sometimes you may need to call language line to translate. You may need to call translator to be in the session as well with you. You may need appropriate personnel to come with you, and because you tak boleh panggil kalau you tak boleh faham apa yang parents cakap. You tak boleh panggil parents lain ke patient lain ke untuk datang translate with you, because those are ada privacy issue. So you need to call a healthcare personnel untuk come and translate with you. And then use jargon where appropriate. So sometimes certain big words, certain big words, you go according to the level of understanding, go to the level of education that the parents have. But sometimes even with doctors pun, sometimes kita kena low down kita kena reduce our jargon. So sometimes kalau if I speak to surgeon, they may not understand everything that I'm trying to say about neonatal issue. Kan, so sama juga. Sometimes surgeon dia cerita kat saya pun, I don't understand everything what they say, because we understand what we know, what we have some idea about it. So sometimes use jargon when appropriate. Cover the concern. So you need to know, you need to ascertain from early on what are the concerns from each party. The parents, apa dia punya concern, patient, apa dia punya concern, physiotherapist, apa dia punya concern. And we need to settle all the concern. We need to cover, we need to assess, and we need to cover all the concern. Concern tu kita kena settle kan. Kita nak discuss pasal result. Sebelum kita discuss, kita tanya apa kerisauan dia, apa concern dia. Lepas kita bagi tahu result, kita assess apa dia faham tak, dan apa concern dia daripada result yang kita dah bagi tahu, for example. So we need to ascertain what are their concerns, assess and cover and settle all the concerns that they have. Reassess understanding. So I said before, reassess comprehension, reassess understanding at every stage of your consultation. And before you end the session, you formulate a conclusion. Okay, mak ayah, kita dah discuss selama 40 minit, dekat sejam dah kita discuss ni. Okay, mak ayah, kita assess balik, apa mak faham tak? Cuba mak cerita balik apa yang mak faham. Okay, lepas tu okay, so saya ulang balik secara kasar ni, kita punya summary, kita punya conclusion hari ni, anak ini macam ni, dan rawatan kita begini. So formulate a conclusion together. Okay, mak ayah setuju ke? Ada apa-apa lagi yang nak tambah dalam kita punya rumusan hari ni? So formulate a conclusion together with the parent, together with all the parties involved. Suggest, okay, agree ke? Kita nak buat macam ni, bila, nak assess bila. Physiotherapist agree tak, ada nak tambah tak dalam kita punya rumusan ni? Dietitian, ada nak tambah tak pada ni? So ask all the appropriate parties involved to give their conclusion. Formulate the conclusion together so that every party will agree and work upon the same management and the same understanding. And then important points. So some are important points. First, you need to show empathy. So we can be emotional. Some people say as doctors, you shouldn't be emotionally attached to your patient. Yes, you cannot be emotionally attached to your patient. But that doesn't mean you cannot be emotional. If sometimes your patient is dying, it is okay for you to cry with them. If your patient has died, it is okay for you to cry together with the parents. It is okay. More so, bila you counsel parents, minta maaf mak ayah, anak dah meninggal. But then you cry together with them. That shows you have empathy. They may appreciate you for that. So I have cried many times when my patient died, when my patient is dying. So it is okay for you to cry with them. It is okay for you to be emotional. But you need to show appropriate emotion as well. Contohnya, if you are telling the parents that their child, their baby is dying, you tak bolehlah muka senyum-senyum tengah-tengah. Tak bolehlah ada orang ketawa kat belakang. You kena ada somber punya mood. So have appropriate empathy. You can be emotional, but you need to show appropriate emotions, and understanding feelings. You cannot say parents yang baru kehilangan anak. You tak boleh say, Mak, I totally understand how you feel. No, it is not possible. But what you can say is, I never felt what you feel, but I'm trying to understand you. I cuba nak faham kesedihan yang mak alami. So, but we need to understand their feelings. Okay, and then open-ended question. So use open-ended and closed-ended. Sometimes we may use. You need to use appropriately. Open-ended questions are preferable, but some may need a closed-directed questions if needed. Open-ended ni macam mana mak rasa hari. Ada rasa open-ended yang soalan yang secara open. But sometimes you need to have some close targeted question as well. Rasa sedih tak pasal ni, for example. So you need to have open-ended question and also some close-ended questions as well. Yes and no questions. And another thing is, do not feed words into their mouth. Bukan kita yang cakap dia sedih, dia yang luahkan. Bukan kita yang bagi perkataan pada dia untuk dia luahkan. Jadi kita nak tanya, we give them opportunity for them to actually say what they actually think. Not we give them the words to use. And be a good listener. Because many times, what parents need from us is not our lecture. Not me. If one of my baby is dying, it's not for me to give lecture about why the baby is dying. No. Sometimes it's just for us to be a good listener and listen to whatever their grievances. So be a good listener. Only a good listener may be a good speaker. Kita kena dengar dengan baik baru kita boleh speak dengan baik. And then non-verbal cues. Intonation. You need to give appropriate intonation. Certain issues, sometimes kalau dia tengah, sometimes kita kena ada mirroring dengan dia punya intonation. Kalau kita punya orang yang kita communicate tu are speaking in a higher tone. So we need to use higher tone as well. Appropriate mirror dia punya tone. Kalau tone yang kalau cakap benda sedih, the intonation should be lower. Kalau cakap benda gembira, tone dia maybe a bit higher, for example. Match dia punya intonation. So appropriate intonation is important as well, because more than 50% of information is actually relayed by non-verbal punya issue. Facial expression. You tak boleh kata you sedih tapi muka sengih. You tak boleh cerita pasal benda yang patient dying, end of life care, tapi you punya facial expression doesn't show the appropriate expression. Kan? You tak boleh macam tu. Body language, appropriate body language, where you put your hand, position of your how you put your hand, how you put your body, and so on and so forth, also is important. This session is not good to do online actually, especially bila my video is not working, because I can show you some way how you put your hand. Can you see me? Ada kamera kan? My camera is not working kan? So I can show you how you position your hand, because that is important as well. And then position your body. If you face the parents, for example, in opposite direction, so muka face dengan muka kan, tapi ada meja tengah-tengah. So sometimes it creates a barrier between them. Kan, sometimes bila you in opposite, muka opposite dengan muka kan, it creates understanding that you are opposite to them, you are opposing them. So sometimes better kalau you cakap sebelah-sebelah. Contohnya parents duduk, you ambil kursi sebelah dengan dia, you cakap sebelah dia, because it shows the psychology with that is that you are with them, you are not opposite to them, you are not against them, but you are with them. Kita bersama dengan dia, bersebelahan dengan dia. So where we position the chair, where we position the table, where we position ourselves is important. So don't be opposite to them, but be with them, together with them. Maknanya side by side ataupun in 90 degrees baru we are seen to be together with them. Appropriate ambience. Mana kalau ada music background ke, make sure macam mana bunyi. Tak boleh ada bunyi orang gelak-gelak kat belakang, for example. And then touching. Sekarang ni musim COVID, you tak boleh touch kan. Tapi sometimes when you speak to them, you hold their shoulder, it emphasizes certain information. Kalau you belajar neurolinguistic programming kan, dia ada kita touch sebelah kanan untuk kita emphasize. So you want to emphasize some information, you bagi satu important information, you touch on the right side. Kan? Less important, benda yang you nak dia lupa, you cakap touch over the left side, for example. So touching is actually important for you to actually masukkan that information into their subconscious mind. Mirroring, as mentioned before, mirror the body tone, mirror body language. Kalau orang tengah diri, you pun diri semua. Kalau orang letak tangan atas meja, you pun letak tangan atas meja. Because this helps in terms of subconsciously understanding. Right. So this is one of the methods that has been, if you look at papers, many papers mention about spikes. For you to interview, for you to counsel, you need to use spikes. Spikes method is S is setting up the interview. So mentally rehearse, you plan, you practice dulu mentally, you arrange the proper privacy, sitting down, use open body language. P is for perception, so elicit the patient's perspective, assess what the belief and feels, assess vocab and comprehension. I is for invitation, so ask patient what they want to know. You invite them to ask what do they want to know. And then obtain permission to share knowledge. So when you want to tell something, you obtain permission, obtain consent for you to share your knowledge. And then knowledge, K for knowledge, provide info in small pieces and use simple languages. So it's okay to have multiple sessions. So you must give it in small pieces. E for emotion. So emotion, you need to explore the emotion, explicitly recognize the emotion and have empathy to the emotion. S is for strategy and summary, so set out a medical plan of action, arrange follow-up. So strategize and plan the action, make summary and so forth, as I've mentioned before. Call for help. Call for help is another information. Always offer to discuss with seniors. So even at my level as a consultant, if I discuss something that is heavy, that is deep, that is important, sometimes I may offer, do you want me to discuss with other neonatologists as well? Do you want me to discuss with someone else? So I can, if you want, I can get another neonatologist to come and review your baby. So always offer discussion, especially if you're a house officer, you're a medical officer, so always offer. We can discuss with other more senior people, because there are always people more senior than you. Always you can offer to refer. Do you want me to refer you? Do you want me to refer this baby to someone else? Do you want me to refer your child to someone else? So offer to refer. Do you want us to refer you to medical social worker for financial help? Do you want us to refer you to psychiatrist? Do you want us to refer you to psychologist? We can offer to refer you to dietitian, for example. So offer to refer, that is important. And offer for follow-up. Okay, kita dah habis session ni for 1 hour. Should we arrange another follow-up? So we can arrange another follow-up probably in 1 week or 2 weeks time, up to you. So we offer follow-up for follow-up session. And then other aids that we can use. What are other aids that we can use? We can use visual aids. Sometimes we nak cerita pasal congenital heart disease, for example. You kena draw lah. You tak boleh cerita PDA, aorta, pulmonary artery, tangan-tangan gerak macam tu kan, tak boleh. You kena draw lah macam mana right ventricle, mana left ventricle, pergi ke aorta ni, pergi ke pulmonary artery, mana connection PDA dia. So use visual aid, use chart. If for example, you are trying to explain to a mother that's about to deliver an extreme premature baby. So sometimes you need to use chart to help them understand, and draw as well, drawing. My drawing is very bad, but I always draw. My drawing is very, very bad. I know about that, but I always draw to patient. I bagi tahu lah, my drawing is very bad lah. Tapi you punya heart macam ni, rupa dia lebih kurang. Okay. So we tell them. So how bad our drawing is, kita bagi tahu lah. Our drawing is bad, tapi macam ni lebih kurang. So I look at orang religi, sebab tadi saya lebih orang kan. Lebih orang religi kat sebelah dia. So it's okay. Yeah, they understand. We are not artists, but we can still draw to help them understand. Yeah, that's it. Anything? So these are the communication issues. Okay? You plan the setting, you summarize, assess understanding, and you need to use other aids that are available to you. Okay. Any question? Clear tak? Boleh buat, boleh faham.
Doktor?
Yes.
I have a question. Macam kalau in adults, the communication for us to relay the information is to assist them in facilitating for them to make decision. But for pediatrics, the communication with children, we aim to relay information. Is it because of the basic rights of human, or what are the end of point in communicating with a children?
It's the same. It's the same. The only, okay, so the only difference is that children, if you communicate with the child alone, the children, they cannot make decisions. Less in Malaysia, less than 18 years old, they cannot make decisions. They can make decisions, but they are not legally bound. They are not legally bound to make that decision. Even if they make decision, they don't have legal authority. So you need the parents, you need the guardians to actually make the decision for them. So, so when you communicate with them, so you need to help them to make the decision. But again, who can make the decision? It depends on the legal binding as well, lah. Legal binding as well. Okay. Faham tak? I'm speaking something else.
Dr. Syed,
Yeah.
for communication, for the, because history taking, so we have many history taking is to know the background of the patient first. So would it be advisable for us to take the social history first, or ataupun kita just hanya biasa-biasa je nama umur kerjaannya? How far do we need to know the background, I mean, first?
Can you hear me now? Boleh dengar tak?
Yes, Doctor.
Okay, alright. So for history taking, you need to remember history taking. The problem with history taking is that that's the moment where you are trying to get history. So should you ask background first? Okay, you obviously you cannot ask detail social history at the very beginning. Sekejap. Nanti kita boleh. Ha? Okay, so it's not possible for you to inquire everything about social history at the very early on. But what I can tell you is, if you ask them early on a little bit about their background, it will help you. For example, kalau sebelum you start clerking kan, you tanya khabar sikit semua, and then you kata, mak, boleh saya tanya dulu, mak kerja apa? For example, mak kata saya kerja nurse. Will not that be easier for you to get more information? Kalau parent tu kerja doktor, for example, that will be much easier for you to get more history. Kalau parent kerja cikgu selalu banyak benda dia cerita, taklah betul sangat pun, tapi banyaklah benda dia cerita kan. So understanding what they work as is actually helpful. It's actually helpful. Okay, alright. Other questions? I need to see patients now. Okay lah. I think that's all. Remind me, I'll send you the slides. Okay, alright. Let's end our session with tasbih kafarah. Assalamualaikum.